going to be talking about the low staff in nursing homes. Imagine coming to see your grandma and you see her sitting in her urine. You see her crying because she wants to get into bed. This is the reality of most nursing homes in the United States. I have been a CNA for 5 years. I have heard lots of stories. I've seen lots of things like that issue. And it's not right. Cutting staff leads to dangerous practices that affect the residents' safety and health. Cutting staff, usually it seems like an accident when you first start out working there. But then you grow and you realize that they do it for monetary purposes. So with doing anything to save money to look good for their budget meetings, even if it's at the danger and safety of the staff and the residents. Management does have a quota. They have a quota for agency nurses. Since agency nurses get paid a lot more than their contracted nurses with the facility. An agency nurse is from another company that outsources their work for a lot of money. This leads to no support on the floor. No staff on the floor means that, nurses will get overworked and desperate. By law, it's required that 2 people will be there when using a mechanical lift. A Hoyer is a mechanical lift where you would take your patient and put a sling under them, like a sling, and attach it to the machine. And the machine will lift up the resident and you will put them in their chair. That is why we use it. But some people use it by themselves because of the desperation. And then it also can lead to double briefing. When someone will put 2 briefs on top of each other and they'll pull one out on the last round. This leads to improper cleaning, obviously, and bed sores, infection, breakdown of the skin, which can lead to more bandage changes by the nursing staff, which means more work. Not adding an extra person, of course, but residents can be leading to more burnout and less staff retention, just so they can hire like a cheap new grad instead of someone that knows what they're doing. This can set residents back, as well as the staff. This can set residents back on their rehab goals, which is the reason why they're there. That affects their health. The problems with these nursing homes is that low staff leads to dangerous practices that are unsafe for the residents. It puts them at risk. It puts the staff at risk. Maybe this issue can be solved if we look into more legislative laws for this. There's currently no laws for patient to staff ratio. Protecting nursing careers from nursing shortages is crucial for the sake of the residents' safety. And I hope that hearing this, you can spread the issue and maybe you can get to the right people where we can start some legislative talk.